All right, Michael, go ahead.
Yes, I came to the Tupelo seminar back, I don't know, probably about 5 months ago or so, and I had all sorts of problems in my right knee. The pain was so severe that I couldn't go up and down stairs without taking one step at a time. The pain level was probably, I don't know, 9, sometimes almost a 10. I couldn't sleep at night. It would change my I'd get irritated very easily, and instead of going underneath the knife, I thought maybe I'm going to try this, and because going underneath the knife is not always 100%. So I went to the seminar, and I thought, after hearing everything that the people said and everything, I thought, I got to try it. I got to try this.
And Michael, how long would you say after you had the injection that you actually said, hey, I'm actually feeling better here?
Well, it was probably about I'm going to say about 4 weeks.
Okay.
Just start gradually, pain started going away, and now I can go up and down the stairs almost quickly, very quickly.
Yeah. Yeah.
And the pain, it's amazing. It's just like a touch by the magic hand,
yeah,
so to speak,
yeah,
and it's gone.
And what about, you were telling some patients here last week that you could actually pick your leg, where before you had to grab your leg and literally pick it up to cross
Right.
it. Tell us about that.
Right. When I was, my dad would drive us to church every Sunday. He's 85 years old, and I'd sit in the passenger seat while the ladies sat in the back. And when I get in, or before, I would have to pick up this leg and put it in.
Mm-hmm.
And now I don't have to do that. I just pick it up and throw it in.
Yeah.
It's just getting in naturally.
Okay.
And it's just like nothing's ever happened. It's just like as if I'm young again. And in shape.
And so, just to reiterate, when you first came in, your pain level was what?
Oh, it was between 8 and 10.
Okay. And where would you say it is now?
Oh, it's not even a 1.
Okay.
And
and with people watching this seminar, what would just be your recommendation? What would you tell them? They're there watching the seminar. What would you say to them?
It's magical. I think you ought to go for it, because look what it's done to me. This is a testimony, and I would tell everybody that came into my path that had a knee problem or anything that I believe in my heart this is the way to go. You have to. You need to exercise. You need to. Sometimes you might have to lose a little bit of weight. You got to do a little bit of lifestyle change too, because if you have way overweight, then it puts pressure on your knees.
Mm-hmm.
And the little things, if you really want it, go for it, because man, I tell you, it's a lifestyle change.
All right. Thank you very much.